Hello, it's Dr. Brian McDonough. Today I want to talk a little bit about the CDC and the new guidance about wearing multiple masks. Now, we've known and have said for quite some time that wearing a mask provides excellent protection against COVID-19. It does it in two ways. First of all, it protects you from getting aerosol into your nose or into your mouth. But in addition to that, it protects other people because your spittle will not go in their direction. It's blocked by the mask. But two masks, it's an interesting thought. Here's what happened. Researchers knew that masks provide protection, so they said, what about different types of masks? Without a doubt, they found the best mask for you, but which very few people have, is an N95 that has to be fit properly for your body. The N95 can fit your face, provide protection. This is what I will wear when I go into the ICU, when I know I'm front-facing someone with COVID. It's a medical mask, it's very effective, and we actually have to be very careful how we use these, about re-exposure, those sorts of things. The fact that most of us have cloth or other types of masks is the reality. So here's the first piece of information. If you can get a surgical mask, that provides the best protection, especially if it fits tightly. So what you would do is you would take this mask, put it over covering your nose and covering your mouth. It's very important. Some people wear them like this. That's a bad idea because if the virus gets into the nose, it actually is a much easier path into the body at higher concentrations than in the mouth. But you notice how my glasses are foggy? If you wear glasses, you need to push them up. And when you first put on the mask, push down on that wire. That stops that extra air from coming in. Because remember, if air goes out, air can come in and you can get virus. If you're going to wear a cloth mask as a second mask, which is what the CD is saying, you can take that mask and put it over your surgical mask. Now here's the deal. It doesn't work as well the other way. In other words, wearing the cloth mask and then the surgical mask is not as good. Why? Because of the secure fact that we have to have a tight fit. It all comes down to the tight fit. If you wear an N95, like you'll see some of the politicians actually have them and they're wearing them, but they wear them underneath the other mask. So you have a surgical mask with the N95 under it. The N95 is closer to the face. You don't wear the N95 over the other mask because, once again, it doesn't allow you to have that secure, tight fit. It all comes down to making sure that the microscopic droplets don't get in your mouth, don't get in your nose. That's the best way to wear a mask. That's why they're suggesting two. Now, do I wear two all the time? Absolutely not. I wear two when I think I'm either in a crowd where there's more people, greater exposure, if I'm going to be in an enclosed area, and certainly if you're a physician seeing patients, you're in that type of a situation, it makes sense as well. But the bottom line here is now there are plenty of masks. At one time there was a shortage, but we now have them. We should use them judiciously, use them effectively, and in the long run, until we're all vaccinated and we get that herd immunity, they're a valuable tool that can help us in the battle against COVID.